Hello, everyone. I'm Jay Lazega, joined by my good friend
Eli.
Jamie today. Uh, Welcome to this installment of L&J's Lazega Johanson's Morning Break. Thanks for joining us. Welcome back. It's been a little while since we've done some of these. We're really excited. The world is changing. A lot is happening. Vaccinations, changing in guidance or executive orders and other things. So we're going to talk today about what is the real answer to opening and operating our amenities this season. Can we, should we, and what's that going to look like? First, a couple of things. To all of you that sent me happy birthday wishes, thank you so much. That was really awesome. I loved that. That was great. So you guys are awesome. We miss seeing you guys. Also, you guys know this, we have a huge amount of resources on our website at ljlaw.com, the resources section. And just this week sent out a really comprehensive discussion of what we're going to talk about and even more in today's session on opening and risks and suggested methods of doing that on our website, plus forms that you can use and download and ton of information for boards. So feel free to use those, share those with your boards. If you're not getting them, let us know. If you didn't get our e-blast just this last Tuesday, let us know. We'll make sure you get on the list. But we think we've got some great resources there, so use that. Okay, today we're going to talk about a couple of things. I mentioned the world is changing. People are getting vaccinated. While numbers are spiking in some areas in the country, COVID-related numbers, the reality is that we are certainly in a safer place today than we were 1 year ago from now. With so much more knowledge, so much more information, so much more guidance from health agencies, from executive orders, others. So we're going to talk about the newest executive order from Governor Kemp, empowering a healthy Georgia. Whether you believe it or not, that it is empowering a healthy Georgia. Regardless, it is the governor's statement of the law in Georgia, and it absolutely helps us in opening amenities, encourages us even. We're going to talk about CDC guidelines, which have been updated for regular amenity and common area opening operations, maintenance, updated for gyms. Many of our communities have gyms. Still some required protocols for gyms, but absolutely softened, relaxed, lessened protocols for other common areas. We're going to talk about Georgia Department of Public Health, GDPH guidelines, which we don't know honestly what exactly they're doing or not doing, but they've not updated their guidelines yet. So we're going to talk about that conflict and how to resolve that, what that means for us. We're going to talk about liability insurance, which still continues to be a risk, a lack of coverage that is likely under many policies. And we're going to talk about release agreements or waivers that many of our communities collected yet last year, what to do this year. And then we're going to summarize with a very quick Q&A summary. Jamie and I are going to share this, but we're excited to be able to do this. We're going to get going. So Jamie, one last thing. You guys have done this before, but in your menu bar, there is a section for questions. Send us your questions. Type in questions. If we don't get to them today, which may be likely because we're covering a lot, we'll reach out to you afterwards. But once again, if you joined us for the last one, our 5 favorite questions in our completely subjective opinion that we get, the 5 people we like the most are going to get, I have this here somewhere, special L&J coolers. These Arctic coolers are actually fantastic. So we're going to give them out to the 5 best questions. Okay, Jamie, let's start up with Governor Kemp and whatever it is he is doing.
Right. Okay, so I think you guys have probably already impressed by me that I haven't actually said anything for like 5 whole minutes. I have been quiet the time that Jay has been introducing all this stuff. I'm proud of myself, so I just wanted to say it out loud. Okay, so when we're dealing with the governor's order, you guys know all the boards of directors for the past, however many, I mean, forever really, but specifically regarding this stuff, the last year, have had a balancing act. They're weighing pros and cons, they're weighing benefits and liabilities. And as Jay kind of already said, and what we've already identified in our e-blast, last year at this time, when you're dealing with sort of the scales, they were tipping in favor of not opening last year. And this year, clearly they are tipping in favor of opening facilities. So let's kind of start with that, and let's talk about the governor's order as it relates to the stuff. The governor's order specifically identifies and acknowledges that people are getting vaccinated. As you guys know, vaccinations are available to everybody over 16 in Georgia. So we're seeing that trend. Who knows if it's going to level out or what the story is going to be, but clearly there are people who are now getting vaccinated that had no ability to do so last year. So that's one of the differences that the governor's order identifies and acknowledges. The other kind of big thing, and this I think is most important for us, is that the governor's order removes the obligation to enforce social distancing. The governor's new order suggests social distancing, encourages social distancing. It actually requires individuals in Georgia to continue social distancing, but it doesn't require organizations to force or enforce those individuals to comply with that governor's order of social distancing. So it really creates a very different obligation for us. I want to just strongly say out loud, though, that even though the order doesn't require that we enforce social distancing, and when we get to CDC guidelines, you'll see the same is true there. All of the documentation, all of the information that we're reading and that we're going to be discussing all encourage that we do try and enforce or create mechanisms to be able to enforce social distancing. So separate exits and entrances for the entry facilities and the exit of the facilities. Maybe a rule that encourages people not to congregate outside of a bathroom or in the bathroom if there's more than one stall. So things that will help encourage others to not get together in large groups. With a pool, it's actually interesting. A number of the CDC guidelines or documentation that I've read online all talk about the noodle and it being 5 to 6 feet. So if you have a noodle space in between everybody, you're doing good. But removal of that social distancing requirement is an important part of the governor's order. Governor's order also does not require that organizations comply with CDC or Georgia Department of Public Health guidelines. There's no current requirement that we comply. It is strongly encouraged. They suggest that we do, but it is not a requirement, which really creates a much more flexible situation for us. And then the other two things I want to make sure that you guys know about is that the governor's order completely removes the whole prohibition against gatherings. I don't know if you remember, but last year you couldn't gather more than 10 people. Then you couldn't gather more than 25 people. Then you couldn't gather more than 50 people. That was the most recent, no 50 people gatherings. And now there's no prohibition about gatherings at all. Gatherings doesn't even appear in the new order. And then the last thing I wanted to just make sure I touch on about the governor's order is that the order now does talk about what's called local option face covering requirements. So smaller governments, counties, cities, and smaller entities may create their own face mask option or face mask requirement. If your association is in an area that has a local face mask requirement, there are some special considerations. So you need to talk to your lawyer. If you're the manager of one of those types of associations, you need to get in touch with the lawyer for the association. Hopefully it's us. And if that's the case, we have some other considerations you need to think about. So just keep that in mind. Those are kind of that.
Good question related from Amanda. So is the elimination of the gathering prohibition applicable to both inside and outside? So can we use our clubhouse now for events?
I would say the answer is yes. I mean, legally, there is no prohibition anymore against gathering. So yes, you can use your clubhouse for events. I will tell you that in the governor's order, while it relaxed all of the obligations to enforce social distancing for gyms and fitness facilities, there are still some requirements, not just some encouragements, but actual requirements. And one of the requirements is that you enforce social distancing when you're in group classes. So if you're going to use your clubhouse for any type of exercise class or any type of Pilates class or yoga, there still has to be 6 feet in between each of the different participants inside the building. So just keep that in mind.
All right, quick couple of questions before we get onto the CDC guidelines, which is where we'll discuss the disinfecting versus cleaning and what the new standard requirements are. But a couple questions about the masks. We plan to do another session that'll cover masks, but generally, what most are talking about in local mask ordinances, like in the city of Atlanta, is that they likely will be public property and not private.
Right.
But that doesn't mean that's going to be the case necessarily in all of them. So we're going to keep an eye on how that plays out. All right,
One thing to mention, though, wait, one thing to mention about the local or this local requirement regarding masks is that the governor's order specifically says that even if there is a local ordinance about wearing masks, it is not enforceable against individuals on residential property. The question is, what is residential property? There is no definition in the governor's order about what constitutes residential property. One would think inside someone's home, but arguably the common areas might be considered residential property since it's inside a residential community association. So that may not impact us at all. It's just really kind of up in the air right now. There's not a lot of guidance on that.
Yeah, we think that's what Governor Kemp meant, that it would cover us. You can't force us with a city ordinance, city executive order to require masks on our common areas.
But there's also a way out of it.
Anyway, but
even if you are in an area that has that, and we're not sure about the whole residential piece, there's a way out of having to enforce that on common property. So just all I'm saying is if your community is in an area that's going to end up with one of those local type ordinances, touch base with the lawyer because there's some things you can do to help the association from avoid liability.
Great. All right, CDC guidelines, and while you're covering that, a couple good questions.
Sure.
We have things like saunas in our gym, special rules for that, or do the gym rules all apply to that too?
Yeah, so I would argue that the gym rules do apply for those types of things and that you need to enforce the social distancing there. I mean, frankly, I would err on the side of being a little bit more conservative when you're talking about indoor spaces versus outdoor spaces. That cannot hurt. And a lot of associations that did end up opening facilities last year created sign-up genius forms where you could sign up for certain times to use those facilities. And for indoor facilities like a sauna that's going to be really small, I would definitely consider still using some type of a sign-up process. So you're limiting the number of people and you're also distancing the amount of time that people spend there.
Yeah, and we're already doing that essentially with clubhouses and club rooms anyway, so we're used to that practice.
Yeah.
All right, CDC guidelines.
Okay, so the main issue here, the sort of main recognition here is that CDC has now literally published in their guidelines that essentially getting COVID from touching surfaces is an extremely low risk. Yep. They say in one of the studies that it's 1 in 10,000 people can get COVID by touching a surface. So what CDC has changed now is that instead of requiring cleaning and disinfecting during all these different times of the day or a certain number of times during the day, they're basically saying cleaning with regular cleaning supplies is enough if you do it once a day. That should be enough.
And eliminating disinfecting, right, Jamie? So not the special products.
Exactly. That's where I was going next. Disinfecting and cleaning are two different things, and CDC guidelines define the differences. Cleaning is using regular detergent or cleaning supplies that you could probably find over the counter that you would think of you would use in your own kitchen. Disinfecting has to be a product that is EPA approved to essentially remove COVID-19 from any type of surface. And there's a website that you can go to put in sort of like the SKU for a particular product and see if it's on the EPA list. And there are a lot of products that are on that EPA list for disinfecting. But there's no obligation to disinfect anymore. There is only a suggestion that you adequately clean, and that is the suggestion that's in the executive order from the governor. And the CDC guidelines say cleaning once a day is enough. They do say, however, in the CDC guidelines, that if an area is high touch, if kids are using an area, if it's a high traffic area, that you should consider cleaning more than once a day. Maybe, before you open, lunchtime, and then sort of towards the end of the day. And that if someone who's been sick or has tested positive for COVID has used your facility in the last 24 hours, you should consider disinfecting, not just cleaning, using a more stringent product approved by the EPA to actually disinfect if you've had a COVID experience at the property within 24 hours. So that's
regular cleaning, normal cleaning that we would have done any time in years past, a couple times a day,
right,
satisfies CDC.
Yeah.
But what about DPH?
So DPH has not changed its guidelines. If you go onto the Georgia Department of Public Health website, one of the first things on their homepage is a PDF that says update COVID-19 protocols. And the update is from June of 2020. So it is not really updated. They have not updated any type of CDC protocols for public pools on the Georgia Department of Public Health guidelines, which is problematic because the DPH guidelines from last summer still say that you're supposed to clean and disinfect regularly, and most importantly, any type of product or item that is used by more than one person has to be cleaned or disinfected in between each touch. So if someone uses a kickboard and then gives it to their friend, in between the two friends using the kickboard, you have to disinfect the kickboard. That is still right now what is on the DPH website. I'm really, like, we all think that they're going to change and update their documentation, but right now we've got this conflict of interest between the two, between the DPH guidelines and what CDC says. And I kind of want to shift gears just for a second to talk about why that's an issue. We still have the COVID-19 Pandemic Business Safety Act, which is a law that was passed at the end of last summer by the Georgia legislature. It goes through July 14th of 2021. We expect it to be extended, but we don't know for sure. And that's the law that basically says organizations are protected from being sued or being liable, if they are sued, for someone getting sick for COVID on their property, as long as you've got your fancy sign that's, Arial font in one inch at your entrance and stuff like that. That law protects associations from liability as long as they're not grossly negligent or worse. And last year's question was, what constitutes gross negligence? Are we grossly negligent if we don't do X, Y, or Z? Are we grossly negligent if we don't do A, B, and C? And the way it was evaluated by all of us was, if you're following all these guidelines, you really can't be considered grossly negligent because you're doing everything all these organizations who are, governmental agencies, as long as you're doing what they're telling you to do, you should be in good shape.
People smarter than us are telling us what to do.
Right. So the idea now is, if that's still the same kind of evaluation, as long as we're doing what they tell us to do, we shouldn't be grossly negligent. The problem now is governor and CDC, they are saying one thing, but Georgia Department of Public Health is saying a little bit more stringent guidelines. And which one should we be following so that we're not liable, at least under this new, this COVID Pandemic Act? And I'm going to say out loud that I think if you're complying with both requirements, the more stringent and the less stringent, then you are in better shape than if you're only complying with one. So we have this window of time. I hope that Georgia Department of Public Health updates their documentation before pools really start opening. But to the extent that they don't, you just kind of leave in the back of your mind that there's this obligation out there that we might not be complying with this year.
So that creates some risk. If DPH does not update, which we expect them to, it creates some risk if we decide to do lesser standards matching CDC. And we still have the issue carrying over from last year that many community association liability insurance policies exclude from coverage claims related to transmission of communicable diseases. So we might have uninsured claims and somebody out there, plaintiff attorney, arguing, well, doesn't matter that there's a conflict, you have to comply with the most restrictive, which is DPH. So we're all hoping that people badger the heck out of DPH and get them to update their guidelines before we're all opening our amenities.
I want
All
to
right,
mention
releases. Want to cover releases, Jamie?
Oh, yeah, sure. What did you releases and waivers?
Yeah.
Before I move into that, I just want to say one thing about the whole kind of protection of the lawsuit issue. One of the big things that we were dealing with when we were weighing all these issues last year was we were very afraid and concerned that we could get sued for someone having COVID on our property, getting COVID on our property. And the issue was we were going to have to pay for our own defense in that case. Most probably we would have been able to win the case, but getting sued and defending ourselves with our own money was going to be expensive. And I just want to kind of say out loud, we have not seen a lot of those cases across the country since last year. We were worried that there'd be a lot of them. We haven't seen any of them. So in the grand scheme of the Balancing Act, worrying about that, I think, is lesser of an issue than it was last year, because we're just not seeing those types of quick cases. Now, of course,
A few. I have seen a few, but
and most associations did not open their facilities last year, which could also be why we didn't see a lot of cases. But I just want to say, kind of in the back of your mind, when the boards are weighing this, that's one thing that seems a little less likely than we were worried it would seem last year. And then the other part of this process, and the other discussion piece here, is releases and waivers. Now, most of our associations, almost all of our clients that opened their facilities last year had users, owners, occupants, guests, if they were allowing guests, everyone had to sign waivers and releases. And essentially it was, I promise not to sue you if I get COVID on your property. I understand, I'm assuming the risk that I might get COVID on your property, and I'm not going to hold you responsible if I do. The problem that we have this year versus last year is that we had a lot of people who didn't even want to use the facilities last year, didn't sign releases at all. We've got kids who were on their parents' releases last year now have aged out or aged up. They should be signing their own releases. And then frankly, we just have some that may have expired, or owners we didn't get to the right people and they didn't sign it.
Or new owners.
Or new owners, yeah. I mean,
and as a quick note, so those releases generally continue to be effective. So if we got last year if you got from me, that is likely still effective. You may not need from me again. Now,
right.
You may need for our children who've aged into adulthood, new owners and others. So there is a gap if we did collect releases that we're going to have to continue that process to fill in.
Exactly.
All right. Jamie, let's do speed round.
Speed round. Here we go.
Questions. Quick summary speed round to close it all out. And we do still encourage people to get releases, use releases. And we believe that as long as the pandemic continues to exist, be recognized as a pandemic, that we have authority to require releases as an alternative to just not opening or opening at a lower capacity.
Exactly.
So, Jamie, speed round. Can we open, should we open amenities?
I would say yes, you're probably looking at a situation where we can.
I agree. Full capacity or reduced capacity?
I think you can go full capacity.
Can we do full capacity?
Yeah, I mean, I think you can. It's going to depend on the size of your property and the size of your facilities. But yeah, nothing stops you.
Do we have to enforce distancing, and should we still enforce distancing?
No longer required to enforce social distancing, but creating opportunities to have social distancing available to owners is a good idea.
What should our cleaning look like? What do you think our cleaning should look like?
I think cleaning should look like, in my opinion, even though CDC requires once a day, I think that if you've got either a monitor or a lifeguard who would be doing this anyway, cleaning at least in the morning when you open up your facilities, cleaning when you close your facilities, and if you can, get in a little bit of a cleaning in the middle, the railings, the high touch areas, the gate, the lock, that kind of stuff. I would definitely do that. To the extent you have no knowledge at all about anybody having used your facilities with COVID, I don't think you need to disinfect with that higher quality product, but you might want to have it on hand in the, at the association in case you need that at some point in time.
I agree. For most amenities, three times a day, and that means everything. Furniture, your bathrooms, your handles. There's no more one thing is more special than another. Everything gets normal cleaning. Again, gyms, a little bit different.
Gyms are, gyms we didn't talk about real quick. So I know that we're in the lightning round, but I just want to mention that with gyms, one of the major changes is that we no longer have to clean all the equipment. We have to have the cleaning of supplies available for people who are using the equipment to clean it themselves. So that's one of the main differences that we actually see in the governor's order now from what we saw before.
And we got to supply the equipment, right? All right, last one, teaser for our next morning break session. I'm not going to ask, should we?
Right.
Can we still require masks, and can we require vaccination proof?
Okay, so I'm going to get, from a teaser perspective, the answer to the question is, can we? I think you might be able to require masks. I don't know that you will be able to require vaccines, but you probably can. Should you is a whole different question. And should you is what we're going to talk about.
Join us for our next one when we cover, can we, should we? What's it going to look like for masking, vaccines, and other things?
Yeah.
Okay. We covered a lot. We went a little over than our normal 20 minutes. Thank you guys so much for joining us. We and I really miss seeing you guys. We hope that we can get back to that really soon. If you have questions, reach out to us. We're always available. And remember to visit our website at LJ Law Resources. Share things with your boards. We have things up there like release forms if you haven't done that yet. So feel free to take them. And we will see you soon. Thanks for joining us.
Thanks, everybody. Have a great day.